Hello there. This is Lady Lou, the baby boomer babe, coming to you from YouTube and Facebook and LinkedIn. And we're live right now on YouTube, Facebook, and LinkedIn. And we have a wonderful guest with us today. But we're going to talk about the Senior Estate Concierge for just a minute so that you folks will know out there what the Senior Estate Concierge is. It's a group of people who have their own companies who help seniors, baby boomers, all of us old folks that we love to have help us. When we get to that certain age, we need to know what is available to us, especially in the medical area. And Medicare is one of the biggies, as you well know, if you're already a Medicare recipient or if you're coming into that age. And so many baby boomers are, we've read 10,000 baby boomers a day are coming into that age 65. So this is right on target for what we're going to be talking about. But the Senior Estate Concierge, again, is that group of people who have all kinds of services for seniors. And they range from insurance to lawn care to health care of all kinds. Just depends on what you're looking for. And I even used them one time when I had a friend who was very ill, and she was a boomer and she needed help. And I called Marion LaSalle, who helps to run the Senior Estate Concierge, and I asked her what kind of help was available for my friend. And she put us all together, and it worked out beautifully for this lady because she was in need of some advice and some help in helping her life to keep going because she was having some challenges, and the Senior Estate Concierge was right there for her. So just know that you can pick up the phone and call them at any time, and all this information will be in the description down below these videos on YouTube, Facebook, and LinkedIn, so that you don't have to write it down right this minute. Just scroll down there and you can copy and paste it, and it's right there for you just to pick up the phone and call. So let's introduce our special guest today. It's Michael Wingfield. Hello, Michael. How are you?
I'm doing fine, Miss Lady Lou.
Great. Well, Michael is an independent insurance broker, and the word independent is the key word here. And he's local. And local can be anywhere in Texas, if you will. He even considers San Antonio his backyard. So it doesn't matter where you are, he is there for you. And being a personal advisor is his passion. He wants folks to know what's available to them. And he'll tell you a story here in a minute about someone who he helped save a lot of money on their Medicare bill. So, Michael, tell us a little bit what your experience is with the Senior Estate Concierge.
Thank you, Miss Lady Lou. The thing I really enjoy about the Senior Estate Concierge is the concept that, let's say you're making that transition to retirement and you're wanting to sell your home, but you don't know where to get moved. Senior Estate Concierge can give you an entire team to help you with. The real estate person who specializes in the senior real estate, a moving company, a person to help you find that right retirement community. So many people work as a team. And the part that I really enjoy about that is when I'm sitting down with my clients and I'm talking to them, it gives me an extra way of saying, I know somebody who can help you. And that's the part that I really enjoy about Senior Estate Concierge, Miss Lady Lou.
I love it. I love it because they're all people with big hearts, or they wouldn't be doing the work they're doing. They are there to help. And it's their passion. And I know I can feel Michael's passion because we talked a little bit before the show, and his heart is in this work. And you're going to want to know him, and he will be there for you in person. And as he said, let people know not to call those 800 numbers they're seeing on television because there's nothing personal about them. They're who knows what state they live in, and they can't come to your house and help you personally. So that's Michael's service. So if you're in the Houston area, San Antonio, Galveston, Spring, all these great areas around Houston, he's there for you. He will come to your home if you choose, or meet you in a restaurant, whatever works for you. So, Michael, give us some stories of who you've helped already.
Well, the one that we had talked about earlier is a lady. I call her a young lady. She was still young in my mind, but she was paying a large premium over time. And she was talking about she just wanted to make sure she had the coverage. So we looked at her options, showed her who her doctors were still working with, and we could actually work with a plan that had practically a $0 premium on that plan, thereby saving her $400 a month she was already paying. That right there was nearly $5,000. And I like to say that was a $5,000 pay raise for her for the next year. And that's not the only one that I've been able to help, but it's always about helping them find the right plan. It's not my choice. I always say if we work together, we understand our choices, the right plan will find you.
That's big. That is very big because there's a ton of plans out there. There's the old fashioned Medicare, there's the Advantage, there's this, there's that. And you don't know, it's hard to know because that's not your business. And Michael can just zero in on what it would do after you've talked because he'll get all this information and then he will help you find that right program that fits you, your budget, your needs. And that's big. That is big. And he'll do it in person. And if you want to do phones, that's fine too. It's just how you want it. He's there for you. So what's some other things that you have helped people with?
Well, it's knowing what their needs are. I actually was working with a husband and wife. We thought at that time, after maybe about 3 different consultations, we we felt we were leading towards an Advantage plan. And we had set an appointment for probably about 4 days after the last time we talked to come in home and do the applications for both the husband and wife. Now, because I'd already had some rapport with the family, he called me the day before and shared with me some unfortunate news that he had been diagnosed with cancer.
Oh,
And he said, but not to worry. He told me, he was very positive. He says, my doctor, my dermatologist has already connected me with an oncologist. And then he's going to connect me with a particular hospital. I knew at that point, I said, stop. We need to be a little bit more careful because the hospital you're mentioning is not very much on the Medicare Advantage side.
oh,
And we had stopped that and put him on the right plan to make sure that when he went to the doctor, they weren't going to say, we don't take your plan. But that's from coming to know what is available and not just go with the first choice. Things can change, and we need to be able to respond to that change. And if you have a good agent, he'll know when we can make those changes and the best way we can go about doing that. So there's other ways that we can help people, and that's finding a right plan for him for his medical condition at that time.
I love that. That was big. I bet you opened his eyes real quick, didn't you?
Yes, ma'am. And we had to understand that it was going to be a little bit more cost than what we had looked at before, but it gave him what he wanted. He knew what hospital he wanted to go to. That's what was important to him.
Mhm.
And we understood that that choice was going to have a slight bit of cost, but it was the right choice for him. And then we were going to work on that. And we said, we're not married to this plan. Once
Oh,
we know that we've recovered, we can always look at other plans on a yearly basis. I'm your agent, not just for today. I'm going to be with you throughout the entire year.
oh. Yes, you do have to sign up for a year. And in December, late November, early December is the time when you can change your plan, unless you're brand new. Now, when you're brand new, you come in whenever. Is that right, Michael?
That's generally true. When you turn 65, you can actually start 3 months before your birthday. So let's say right now is the month of April, starting tomorrow. You would have April, May, and June. If your birthday was in July, we could actually start 3 months early. But I'll even start 6 months early because the more time we have, the more I can talk to you and do a deep dive into what are your medical needs. And then it gives us more time. Because like you said, Miss Lady Lou, there are over 60 plans available just in the Fort Bend County, let alone the Harris County. So that
Oh,
gives us more time to actually evaluate all the plans and find what one's going to work right for you.
right. And what did Marion say? Oh, good. Would I be covered? I
If
travel. Ah,
All right, that's an interesting question there. When people say I travel, I say, are you traveling to a new home, a second home? Like I have people who live in Wisconsin and they come to Galveston for the winter. That's a different way I have to look at that because that's a change in residency for part of the year. Then there are people who travel, maybe how often? Well, I travel 2 times a year to go see my grandkids. How long are you gone? 2 to 3 weeks. Your plan should still cover you. Do all plans? Every plan's different. So I need to consider that and put that into the formula.
I
Okay.
like that. Thank you for the question, Marion. Now, what's this next
Says
one?
if she's visiting her doctor in Michigan.
Yes.
Again, most of your carriers are going to have something that allows you to travel and have emergency care. Now, if you're in Michigan, you're not going to be able to see a regular specialist. If you're, again, it's going to depend on what type of plan are we in. Are we on a supplement plan or are we on an advantage plan? Two completely different ways of handling this. This is why I work with both supplement and the advantage side, because when I'm talking to you, I need to find out which one's going to work right for you.
Well, let's talk a little bit about supplements because Medicare does not cover everything fully. So tell us a little more about that, Michael.
Right there. When I'm talking to everybody, I start with what I call the triangle of life. An upside down triangle is you start on original Medicare. What does that mean for you? What is part A? What is part B? And I help them understand that. But the biggest thing that I find that a lot of people don't really give consideration to is what happens after you pay your deductible. Because, yes, when you're on original Medicare and you haven't done anything else, you still have a deductible for your Part A and a deductible for your Part B. But the hardest part, and this is what I want to convey to everyone, is even when you reach the deductible and the government takes over 80%, the 20% you still have has no limit. There's no cap. So a simple trip to a hospital for $60,000 could leave you still having to pay $12,000. And that's why I say we've got to protect ourselves against that 20. Should we look at a supplement? Should we look at advantage? Supplement plans are very simple. You pay a third company. It could be a carrier such as United Healthcare. It could be a life insurance company like Mutual of Omaha. You've entered an agreement with them that once you reach your deductible, they take over. And that's why a lot of people say, well, my mom, she never had to pay anything. Probably was on a supplement plan.
Yeah, because that's so important. Because who needs to be stuck with 20% of a bill? Because 60,000 is a very small bill when you go to the hospital.
Yes, ma'am.
I don't know. I'm thinking 100,000 is probably more like it. If you're lucky, it's 100,000 or less. But that supplement is got to be there for that emergency
Right.
because we seniors don't have 12, 15, $20,000 to throw at a medical expense. We got to pay rent or mortgage or whatever we're paying with our own money. So the supplement is well worth the price. What's an average payment for a supplement? Just around figures.
It's really going to depend on the age. That is one thing that I see with the supplement side is I call it inflationary because the cost does change each year you have a birthday. But I would say your entry level when you're 65 could be anywhere from the low 110 to maybe mid 150. It's also going to depend on, are you a smoker? Okay.
Oh,
I see we have a question from Miss Phyllis asking,
yes.
do I work with retired military? Yes, I do. And
Yay.
retired military has a package called TRICARE for Life. And that we want to talk about one-to-one, Miss Phyllis, because TRICARE for Life has a lot of strengths, but we want to talk about how can we merge that with Medicare And will it work or will it not? I will be the first person to say, I think TRICARE for life is what we need right now. Or, and I'm not afraid to say, let's just stay where we're at, because the thing is one answer doesn't fit everybody. But yes, I do work with retired military, and I am becoming every day more familiar with the TRICARE for life, primarily because my mother in San Antonio is she's the spouse of a retiree. So I'm always learning more about TRICARE for life.
Yeah, it's an excellent program. I'm also the widow of a retired Air Force. And the military still does take pretty good care of their people, let's face it. That's part of their responsibility to the military people. So we're very grateful for that. So, what's another question that so many people ask you, Michael?
They'll always ask me, uh, I get the question about the Part B premium. Why do I have to pay the Part B premium? And I wish I had a simple answer for that. There are ways that we don't have to pay that, but it's going to be income driven. But the Part B premium, if you think about it, that's everybody, whether it's me or Bill Gates or, we're all paying the Part B premium, and it is set by Congress. The one thing I do get asked about is, tell me more about so and so on TV, such and such football star says I can get money back.
Yeah.
There are give back programs. It's going to depend on what plan works for you, because this is the part that I'm hesitant on. Is, remember, when they're offering something, they may be holding something back. We need to look at that, because honestly, I have sat with people who are saying, I get $95 back on my Social Security check every month. I was like, it sounds good. But we'll look at the plans, and you're paying twice as much to go see a regular doctor. You're paying 50% more to go to the hospital. And I'm like, we can come over here to this plan, and if you need to use it, it's not taking as many dollars away. Plus, that company has a give program where they can give you credit for like over the counter goods. So it balances out and doesn't really cost you more on the backside for accepting that gift of $95. Hope I
Oh,
didn't make that too confusing.
yeah, because every time I hear that ad, I thought, well, am I missing out on something?
I won't say it's bad, but we need to look at what you have, what are you eligible for, because sometimes you're going to actually come out ahead by not accepting the $95.
Ah, yeah, because that other could be out of pocket crap too, couldn't it? Money
Yes,
that you
ma'am.
have to spend over and above. And that's why you need Michael on your side, folks. This is big. This is really, really big. Well, tell us a little bit about Part C. Has that changed any over the years?
I like to hear that one, because Part C is actually your Medicare Advantage. That's taking Part A and Part B, taking the Part D, the drug plan, and putting it together and offering you an Advantage plan. Here's where I like to educate folks. When you're on a supplement plan, the first side of this triangle, you're still on original Medicare. When you go to Part C, you've actually disenrolling from original Medicare to begin a partnership with one of the carriers. This is why we see the plans called $0 on advertised. It's because the premium's actually being covered by Medicare itself. Therefore, and this is where the great part about competition is, these companies are now collecting the premium from Medicare on behalf of you, and they want you as their client. So what we need to do is make them compete for your signature. And this is where you see a lot of the Part C plans. One year they're offering this, and then the next year another company will increase, say, dental as an example. One year one company might be offering $1,000. The next year the other company, they want to compete. They say, we're going to increase that to $2,000. That's my job, is to know where all this is taking place. And this is why I always say, if you have a friend who says, I'm already on Medicare, I'm happy with my Medicare, if you haven't compared your Medicare on at least every 2 years, you may be falling behind with what the companies are offering now.
Oh,
So let's just at least do an evaluation on a yearly basis. It really doesn't take a lot of my time to look at what you have, what you want, and to tell you if you're still in the top three.
yeah, and you can do that by phone, can't you?
Yes, ma'am.
Oh my God. Tell us your phone number real quick, Michael.
281-665-9519, and it will never have a 1-800 in front of it.
I love that. Oh, see, that's what the advantage of is having someone who's local and who's going to end up being one of your best friends. I can tell you that just from knowing Michael this little bit of time. He's going to be there for you. He's not going to abandon you. He's going to help you. And so many of us need that help, because especially the ladies, the widows. We just don't know what we don't know. And there's Michael. He's just like a beacon in the sky. Here comes Michael to the rescue. So I want you, all of you, men and women, to know that Michael is there for you. Now, he makes a living selling insurance, yes, but that's the side part of it for him. The passion he has is for helping the people, you. Is that right, Michael?
Yes, ma'am. I always tell my clients, I am paid, but my rate is set by the federal government, and I'm paid through the government, through the carrier. So it really doesn't matter which one of these 5 companies we look at, I will be paid the same. I want you to understand that, so you know I have no incentive to steer you to a different company. But the reason I want you as my client is because I want you to be treated the way I expect my mother to be treated. That's always been my golden rule. And if I can help you next year when you get bombarded with those phone calls, I fully expect you to say, I already have an agent. His name's Mike. Please
Yay.
take me off your calling list.
Oh, I love that. And from what I'm getting here, I just want to reach out and hug you. Yeah. And I bet a lot of folks do hug you when you work with them, don't they?
Yes, ma'am. And that's why I say that I'm just a young 55-year-old, but I am never retired from this, because as long as I can get in that car and drive to your house, I enjoy what I do. And that's what picks me up each morning. I don't see myself retiring. Like I told you earlier, Miss Lady Lou, I may take a long vacation from time to time, but I will not retire.
I love it. And that's the kind of people we want to work with, isn't it? I know I do. Because if I wasn't already in the military thing, I'd be over there talking to Mike real quick. Because this man has had the education, the training, that he's licensed, fully licensed. You can't sell insurance without a license. So you know he knows what he's doing. But I bet you have to go back to school occasionally too, don't you, Mike?
That is why I say we're good at what we do, because your typical health insurance agent has to have 20 hours every 2 years. Well, I have to maintain that as well, just to have my state license. But to work with the federal government, I have to be
Yeah.
certified on a yearly basis. And then I take that same training and I have to do it again with each carrier. So, yes, I spend quite a bit of my summer staying afresh of what we need to know.
There you go. Because if they're not trained, it's not going to help you, because they won't know A from B, and B might be better than A. And
That's
Mike knows all of that. So you got to pick up the phone and call Michael. As soon as this show's over, you call Mike. He will help you. He'll be there. He'll come to you. Like he said, he goes to San Antonio occasionally because it's like in his backyard. He doesn't care. He's happy to go because he wants to be there for you. And it's a beautiful drive, right, Mike?
It is, especially this time of the year.
Oh, yeah. Our bluebonnets are coming
Blue
out.
bonnets.
Oh, that's great. Well, what's one more thing that you'd like to leave the folks with?
The honest answer is I am not afraid to say I can't help you.
Oh,
But what I'm going to ask people to do is, please do not call a 1-800 number. You don't even have to call me. The 1-800 number is not your friend. They just want to know a few pieces of information, and sign you up on a plan. It may not even be the right plan, because in January, I will be talking to people who say, I called 1-800 and now I find out only 2 of my 5 doctors are on this plan.
Oh,
So please call a local broker. It doesn't have to be me, but call somebody who's going to invest their time in finding you the right plan.
yeah, those words are priceless. The local folks can help you the most. Wow. Well, Michael, I so appreciate getting to know you and how you help people, and to know that you're there for the seniors, because we need you. We need you big time. And we can appreciate that you even know other people who might help these people. Is
Yes,
that
ma'am.
correct?
It is correct. And like I said, my favorite thing to love to say across a kitchen table is, I know somebody who can help you.
There you go. And referrals are the best. So when you're signed up with Michael and you know and love him and he's done the right job for you, refer your friends and relatives. That's how Mike gets to help more people. And it's simply word of mouth. This is better than any kind of a television ad or a radio ad or any kind of an ad. It's word of mouth. Share with your friends and relatives. Wow. Well, thank you, Michael. This has been a wonderful time here, and people I feel have learned some things. I've learned some things that I didn't know. So I thank you so much for being here. And what one last word would you leave with us?
Senior Estate Concierge. If you need anything, they'll probably be able to find an answer for you. Even if it's not, you'd be surprised how many different people have committed to helping the senior community. And the Senior Estate Concierge is a very good group.
It
These are
is.
people whose passion is for your community.
Yes. And Bill Graft is a fabulous man. He's the founder of Senior Estate Concierge. His heart's in the right place too. So you'll be able to find whatever it is you need. Well, thank you again, Michael. This has been wonderful. And share this video with your friends too. Just take that link out of the browser and send it to your friends all over the world if you need to, because Michael can go anywhere or make a phone call anywhere. Thank you again, Michael, and we'll see you again another time.
Thank you,
Bye
Miss
for
Lady
now.
Lou.
Thank you.